Rick, let's start with how telehealth has progressed during the pandemic and how effective it's been.
Absolutely. So about 2 months ago, when all of us began to shelter, quarantine, and essentially live out of our homes, we lost access to all of the brick and mortar capacity across the system. And it's been rather inspirational to see not just Premera, but the entire Washington state quickly transform to be able to support telehealth. In a matter of weeks, all of our provider systems onboarded all the technological and human capacity required to be able to support our members. Premera launched a number of digital vendors, including some local ones, that expanded access points for our members who obviously at the time were primarily concerned with COVID, but now have all of their healthcare needs being satisfied in telehealth. It's been great to see the market respond like this. To give you context, in the month of February, we had about 3,000 claims come through for telehealth. In April, we had over 70,000. So it just shows how quickly we've adapted to this new world.
Well, and patients have adapted as well. They've tried something new, most of them, to get medical help. What would you say is the easiest, best, safest way for people to enter telehealth?
So if you are already working in one of our local systems for your healthcare needs, for instance, Providence or University of Washington, Evergreen, et cetera, they all have telehealth capabilities that will allow you to continue to coordinate your care through that local provider. For those who are somewhat like myself and don't necessarily seek care all that often, there are a number of other options. For instance, companies like Seattle-based 98.6, Doctor on Demand, Teledoc, et cetera, that any local carrier likely makes available. I know here at Premera, we support all of them and have waived cost shares at least through the end of June to allow you to seek that care. And again, it really depends on the needs of the member, but there are a number of access points across the ecosystem.
What happens to people who are uninsured? Do they have access to telehealth?
They do. So all of these companies will see the patients, particularly in this time of need. It's amazing to see them step forward to provide that type of care, even for those that are uninsured. For instance, there's one company we work with called Boulder Care, and they provide online access to opiate use disorder treatment. And obviously behavioral health is critically important, particularly at this point in time. And they have agreed, for instance, to see any patient that comes through regardless of whether you have coverage or not. And most other carriers are willing, carriers and health plans and local providers are willing to do the same.
People can still come into an office if they have a serious problem that requires an examination, correct?
They can. So while the number of providers that have open offices is very, very small, obviously emergency care, et cetera, is still available. It's a little bit stretched from a capacity perspective, but if you have needs, you do have access points. And over time, as we slowly start to come back, you'll see more and more provider offices start opening. And my sense is people will start to get some of the care that they maybe have postponed at that time.
You mentioned the growing numbers, and it's really pretty astonishing. So what are the implications for the future? Will we continue this even when the pandemic is not with us?
Premera is betting that we will. I think many members, both anecdotally and from the actual first round of evidence that we've seen from our claims, are understanding that a substantial portion of your healthcare need can be satisfied from a telehealth perspective. And it's really convenient, doesn't require you to leave your home or in the future leave your work. And we're so invested that even today we're announcing that we're going to put forward a product where virtual care is your entry point into the actual ecosystem. Because it's so effective at solving needs and doing so at a very low price point, we think there are going to be some members who say, you know what, that's enough for me. I'd like that to be the primary access point for my health plan in return for a lower premium. So it's really, really great that we can solve a lot of your needs in a convenient way through telehealth. And in return for using that as your primary access point, can give you a lower cost out of pocket to be able to access that care. So we're betting that we will be able to over time.
So describe to me what that looks like. Would that be an in-person contact with someone, or is it something different than that?
What we're going to do is you will have on-demand access to primary care. So literally take out your phone, and within 90 seconds, you will be either having a text-based or video-based encounter with a physician. Where that physician is located could be potentially anywhere in the country, but they will be licensed to work in Washington. And they will do everything they can to solve every particular healthcare need you might have at that moment. And they will do it for free. There will be no cost to the member as long as you're using telehealth. If they can't solve for that, and you do need to go to a brick and mortar facility, we have provided them with the highest quality options based upon where you live to actually refer you to. So they can say, you know what, I can't solve that here, but a local provider, Dr. Smith, actually is a great reference here for you to be able to solve for this. I'll go ahead and send through the referral. and the member will be able to access that care at a lower price point as well. So it really solves a lot of problems and does so in a way that's really convenient.
And when you talk about lowering costs, you're talking about lowering both premiums and copays.
Both. We are able to lower both in that environment.
Are there areas of medicine that are not particularly fit for telehealth?
So some specialty care really can't be done in a telehealth setting. For instance, you're not going to be able to have a surgery, which seems obvious. But most primary care, urgent care, and even some specialty care, things like dermatology, et cetera, can be done in a telehealth environment. If you think about dermatology, let's say you get a rash. The great thing is you just take a picture of it, you can upload it right to the doctor. They can take a look and say, yeah, I can treat that. So things like surgeries clearly are not going to be able to be done, but most other care can be. And we're actually seeing that in the claims, that it actually has been migrated to that environment.
Let's talk about pregnant women and babies as two categories. I remember that being a high-touch experience in a medical
Yes.
setting. So would that lend itself at all to telehealth, or do we have special instructions for women who are expecting?
Yeah, essentially some of the services that are done, for instance, getting the scans, taking a look at the baby, et cetera, those cannot be replicated without actually sending some of that equipment to someone's home. And frankly, at this point, most of the system is not equipped to do that yet. But there are companies out there that are moving into the space and actually starting to deliver a large amount of tools and equipment that will allow us to do some things. But if you're a pregnant mom, it's really important to keep that relationship with your OBGYN. But you probably will, it's more important to actually keep quarantined and stay safe to make sure that you stay healthy throughout that pregnancy. So there are some things that you're not going to get to do, but overall, I think you'll at least be able to take care by keeping that relationship with your OB.
And for newborns and babies, it's sort of one thing once kids can talk, but it's frightening when your baby is sick.
Mhm.
Is that something that you would
Yeah.
want to see somebody about as opposed to telehealth?
Yeah, most of the telehealth options that we work with will see a child ages 1 and over. Generally, too, when you have a relationship with a pediatrician, that pediatrician can be available, obviously, via text, via phone, and off hours as well. Most companies are comfortable providing some sort of diagnosis through the phone, video, text, et cetera, to 1-year-olds and above. And if you're below that, obviously having a strong relationship with a pediatrician who can advise you when you might actually need to use that ER for more serious conditions is probably the best way to go forward.
And one question about people who are just not comfortable with this, who don't feel like they've been seen if they
Yeah.
haven't been examined. They want that experience. What should they do?
Yeah, so unfortunately for the near term, I would say they should heed the advice of the local and state governments and probably quarantine for as long as we're going to have to. But at some point, we are going to see some people migrate back to the brick and mortar systems as provider offices begin to open. And I think we advise them to take the appropriate precautions, wear your mask, wash your hands. And if you really do want to see a provider that you feel, to your point, needs to get your hands on you to understand the condition, you will be able to do so soon. But until then, there are a number of options that are actually available that can at least give you peace of mind, so you're not at least worrying. Is this something severe? Should I be doing something more drastic? Do I need to go to an emergency room, et cetera? So if nothing else, try to use the services for that reason. And then at some point, probably this summer, you will start to see provider offices open. And that's when you can actually start just seeing the doctors physically.
Perfect. That's exactly what I needed. Thanks so much for your patience.
Absolutely. Thank you so much.